Kerala's Health Minister, Veena George, announced on Monday that the state's high-level COVID committee is closely monitoring the occupancy rates of ICU beds, oxygen beds, and ventilators in both government and private hospitals. This comes in response to a slight increase in COVID-19 infections in the state. George stated that a meticulous assessment is underway to determine if there is a surge in the utilization of ICU beds, oxygen beds, and ventilators. To ensure bed availability, an online mock drill was conducted between December 13th and 16th, involving 1,192 government and private hospitals. The state has prepared a total of 1,957 oxygen beds, 2,454 ICU beds, and 937 ICU beds with ventilator support. Despite the rise in infections, Minister George urged the public not to panic or spread fear. She explained that the increase in cases has been observed since November, prompting the testing of samples for whole genome sequencing. A 79-year-old patient from Karkulam in Thiruvananthapuram district was identified as having the JN.1 subvariant of the Omicron variant. George emphasized that while the variant is highly transmissible, it is not severe, and vigilance is essential. The health minister highlighted that 15 travelers from India tested positive for the JN.1 subvariant at the Singapore airport, indicating its presence in other Indian states. The alertness of health officials and the robust testing machinery in Kerala led to the confirmation of this variant in a patient. In response to the identification of the JN.1 subvariant, the central government issued an advisory to all states, including Kerala, urging continuous vigilance. Minister George clarified that recent COVID-19 related deaths in the state were individuals already suffering from severe comorbidities and were not a direct result of COVID-19. She emphasized the need for elderly individuals and those with serious illnesses to take precautions to prevent contracting the virus.